Okay, my name is Massimo Lazzeri. I am a neurologist and my place is Humanitas Hospital in Milan, and my field of interest is translational science and research. Okay, this is a new study, as you read, and this is a new paradigm. There is a shift paradigm for the approach to non-muscle invasive bladder cancer. We know that the neoadjuvant chemotherapy is the standard of care for the muscle invasive bladder cancer, but only few experiences exist about the use of neoadjuvant treatment of non-muscle invasive bladder cancer. The rationale of the study and of the ongoing study we are going to do is based on a new approach to the use of the mechanism of action of mitomycin C. For a long time we thought that mitomycin C acts as a cytotoxic agent, but now we found that mitomycin C may induce an immunocell death, and this immunocell death is linked to the release of specific signals from tumor cells such as HMGB1. And the reason why we approach is because after transurethral resection of non-muscle invasive bladder cancer, the standard of care is an adjuvant treatment by intravesical chemotherapy mitomycin C or immunotherapy BCG, but the response is quite variable, and so the first question was why the response is so variable, and in vitro we found that some patients may respond and other patients cannot respond. It was based on the capacity of mitomycin to induce in tumor cells the immunocell death. Oh, okay. For the recruitment, we look at naive patients, regardless of the stage and grade, and or treatment naive, so we include also patients with a recurrence in non-muscle invasive bladder cancer, but without an history of treatment. And so this is very important because in the past several authors tried to investigate the similar approach of neoadjuvant treatment, but they look at the recurrence in some cases only. This study look at a primary cancer, but it was in 2011, 12 years ago. I would say that it's not so similar as you said. Our study has several advantages according to us, but we hope also according to patients in the future. And the main advantages is a study which aims to patients with a non-muscle invasive bladder cancer regardless the stage and the grade, because using this new mechanism of action, immunocell death, we think to empower the innate immune systems at the same time as well the acquired immune systems. And so we can imagine that every patient may benefit from this approach, even if with a muscle invasive bladder cancer in support, for instance, of immunomodulators, such as, for instance, pembrolizumab. So we think that in the future we will look at neoadjuvant treatment as an overall approach for every kind of bladder cancer in order to support and empower other treatments.